Join us in welcoming Neera Tanden, Domestic Policy Counsel, the White House.
Thank you. Thank you so much. How's everyone doing today? Okay. I know it's like late afternoon, so trying to bring some energy here. It's great. Great to see everyone here. I'm really honored to be here at the Kennedy Forum, and I'm really honored to be with Patrick Kennedy, who is a national treasure on this issue and a fantastic leader. I'm the President's Domestic Policy Advisor, so I oversee all of his policy issues. But before I was in this role, I was president of the Center for American Progress, which is a think tank in Washington. And over a decade ago, Patrick spoke at the center and laid out an incredible strategy of how we can deal with mental health challenges, but also how we should center mental health in our healthcare system. And we've learned a lot from Patrick over the years, and it was fabulous to see him earlier this summer when the president laid out his strategy and really focused on mental health parity, which I will talk a little bit about today. So I really appreciate Patrick's leadership and excited to be at this forum, at this convening, which is really bringing so many leaders from around the country together on this topic that is so critical to our success in our healthcare system, but much more importantly, our success as a country. So I think it is really fitting that we're here at the Kennedy Forum. 60 years ago this month, President Kennedy signed the Community Mental Health Act into law, which paved the way for a massive transformation in how we address mental illness, leading to significant investments in community mental health across the country. And I really believe that President Biden has built on this strategy by proposing a comprehensive agenda to address mental health in America. Put simply, the president feels that mental health care is health care, period. That animates all of our work and really animates his orientation to the issue. He really believes that it's essential for people's well-being and their ability to lead a full and productive life, to find joy, to find purpose, to take care of themselves and their loved ones, to really be part of the social fabric of the country. And that is why the Biden-Harris administration has really focused on tackling the mental health crisis in America. President Biden and this administration are committed to improving our mental health care system's capacity, which means making investments in infrastructure, workforce, prevention, treatment, and recovery. And you know, all of these issues are a focus of this convening. When we talk about our comprehensive mental health agenda, it really has three core components. What we describe as care, coverage, and causes. First, I'll take up care. And what that really means is how we need to ensure there's more health care in the system, that there's more access for mental health care. It's why the administration has invested over $1 billion into strengthening and expanding the 988 suicide and crisis line. 988 has had more than 5 million contacts since its launch. That means millions of people who are helped at this most vital moment. It also means investing in community mental health centers across the United States. These facilities provide 24/7 care to anybody who needs it. I know everyone knows that here. There are now 500 certified community behavioral health centers in 46 states. Yes, this is a big achievement. And just to say these things come full circle, that's thanks to President Kennedy, whose legislation established and invested in community mental health centers for the first time. It's also because of leaders in this room who've been strong advocates for many, many years. And I'm proud to say that during this administration, we've built on this legacy with adding more than 140 centers, the farthest expansion we've had in decades. In just last month, the Department of Health and Human Services awarded nearly $130 million to expand community behavioral health clinics, including 3 here in Massachusetts, in Fitchburg, Jamaica Plain, and Springfield. So we're happy about these investments. But another crucial element to care is mental health support outside of traditional hospital or clinical settings. We've invested $15 million from the American Rescue Plan to help states build mobile mental health crisis teams that deliver care outside of a clinic or a hospital, where people are, where they need it, really going to those places that are sometimes really hard to reach. And over the next 5 years, the Department of Education will invest $1 billion from the Bipartisan Safer Communities Act to help schools hire and train new school-based mental health counselors. Yes. I just want to say a word about this because it is a part of what the federal government has done that gets less attention. The Bipartisan Safer Communities Act, what we call BISCA, is investing $280 million. It has invested $280 million so far, and over time it will create 14,000 school counselors in schools across the country. 14,000 will be supported by this work. That is such a vital part of our efforts to address mental health issues, but it's also really critical to address our students' learning loss and other issues. Next, let me turn to my favorite C, which is coverage. I've worked on healthcare for a long time, so I do get excited about the things we're doing to expand coverage. As everyone knows, I know it's been a rich source of discussion here about the Mental Health Parity Act and the promise of that it was 15 years ago, really now, that we passed this bill. But we have never really reached the promise of this legislation because today it is the case that mental health care is not truly treated like physical care by our insurance system, by our private insurance system. This is an area where many people have been working for a very long time, and I am really proud of the work that the Biden administration has done, HHS, Treasury, Labor, to develop a new rule which is designed to ensure that we have true mental health parity in the country. Today, I think we all know people who have paid out of pocket even when they have insurance for mental health care because they can't find a person on the network provided. Now, what we've learned is that insurers often have too few people on their networks. They put burdens like prior authorizations and often pay providers, mental health providers, less than they pay for physical care, which has led to a system where Americans with insurance are paying $14 billion a year for mental health care. And what does that really mean? That really means that mental health care too often is for people who have enough resources, and for people who can't pay, they don't have the care they need. Because we all know, we have story after story, and when we've been learning about this, when we've been developing this rule, we've heard story after story of families who are paying $1,000 out of pocket for the care of addressing the mental health needs of their children. We have families, there's a family in Michigan who spent $14,000 out of pocket because they don't have access to a provider, sufficient access to a provider. On the formularies, there are people waiting 3 years to get someone who is covered. And that is why the mental health parity rule the president announced this summer is so important, because it truly requires that insurers take steps, really requires insurers to end the practice of treating mental health care, mental health providers differently than physical care. That's a vital move. I see someone about. One family in Michigan that was at the president's event talked about how those thousands upon thousands of dollars have really meant a significant difference in their livelihood. How it's hard to make up rent and pay for mental health care. And this is a family that has insurance. And so that's why what I consider, I think this will be a really landmark rule, because it will ensure that insurers have to actually provide information to regulators about how they are ensuring there is real parity. And over time, because mental health providers will be reimbursed at the same rate as doctors who provide physical health care, we hope that this will also induce more support, put more funding into the mental health care system, and ensure that we have more providers into the future. So I think this is a critical step in how we build the infrastructure of our mental health care system to be built to focus on the long term. Finally, there is the issue of causes. And I do think that we have to recognize that we've seen really increasing rates of mental health challenges, mental health concerns, particularly amongst young people. I know there are many experts in this room who probably have a wide divergence of views on these issues, but I also know that there have been societal changes that have really driven, many people consider a driving force of this. The U.S. Surgeon General, Dr. Vivek Murthy, a good friend of mine, has done a lot of work on the connections between mental health, growing loneliness, and social media. And I do think we need to have a robust conversation about the aspects of social media that drive concerns, particularly amongst younger girls, teenage girls, about self-image, depression, and really this radical increase in suicidal thoughts. There's bipartisan legislation to ban targeting advertising online for children and young people and to enact strong protections for data, but we also need more research into the connections between social media, mental health issues, as well as other issues and concerns. So I'm really here today to not just focus on the mental health system and talk about the president's agenda around mental health care. I do think this is a historic level of investment that has been made over the last several years in the mental health infrastructure. We do need to invest more. We need to attract more people into the profession. Workforce is such a critical challenge. But I'm really proud to be here with you today because this is such a priority, and we have so many leaders in this room who've helped build a much better mental health care system, a system that is much more nuanced, much more capable, and much more flexible in the 21st century. We have a way to go, but we need to recognize the significant changes over the last several years and how your leadership, the leadership of the Kennedy Forum, and I will also say Patrick Kennedy himself, in making our mental health care system strong and vibrant for the 21st century. Thank you very much. Great.
So Neera, before Neera leaves, just understand, most people didn't know what EPSA was. Most people may not know the Domestic Policy Council, but they are the architect of a broad range of departments within the administration. And what we're talking about at this conference is how to coordinate between all of the agencies that in the Domestic Policy Council you oversee. So you're really giving the answers to the test for Department of Labor, HHS, Department of Justice, Housing. Most people don't know those decisions by those agencies aren't made in a vacuum. They're made out of a blueprint that Neera and her colleagues, especially our good friend Terry Tannelian,
yes, is Terry here? Terry is the president's point person on mental health. So.
But she has been our champ. But I just want everyone to know, I'm so grateful. This president has done more on mental health than anyone. He has overseen this new rule that you've just pointed out, which is going to require outcomes. Before it was processes. Mm-hmm. This new rule requires outcomes be demonstrated. And that is a huge leap forward in the application of parity. So, Neera, know how grateful we are to you and the administration for coming up here today.
Right back at you. Thank you.